Hi, I'm Dr. Tessa Commers. I'm a pediatrician and have a special interest in sexual health. I'm the head of medical education for Julie. Today's question is, how will I know if I have an STI? STIs can affect the vagina in a few different ways. Bacterial STIs like gonorrhea and chlamydia can cause a variety of symptoms, like vaginal discharge changes, vaginal odor changes, pain with peeing, pain with sex, bleeding with sex, and they might cause no symptoms at all. Viral infections like HPV might cause genital warts, or many years down the road can lead to things like cervical cancer. Another viral infection, herpes, might cause flares of very painful ulcers that come and go. Parasitic sexually transmitted infections include things like trichomonas, which can cause changes in vaginal discharge, changes in vaginal odor, and pain with sex. Another parasitic infection is pubic lice, which causes little lice and itchiness of the pubic hair. STIs can affect the penis in a few different ways. The most common symptoms that someone with a penis will experience when they have an STI will be pain with urination or abnormal discharge from the penis. However, a lot of STIs don't have symptoms at all. Herpes is a type of viral STI that can cause very painful ulcers that flare up or come and go. And HPV is a type of STI that can cause genital warts, or further down the road might cause things like penile cancer. And finally, there are parasitic STIs that can affect the penis, including trichomonas, which is usually painful urination, or pubic lice, which is basically lice of the pubic hair. STIs can spread by more ways than just penis to vagina sex. The mouth can be affected by STIs, the anus can be affected by STIs, and STIs can also live in your bloodstream. So symptoms that you want to be aware of, especially when it comes to oral STIs, include sore throat or lymph node swelling in your lymph nodes of the neck. Anal STIs can cause changes in your bowel movements, including things like constipation or diarrhea. You might notice blood in your poop, or you might notice a rash or an abnormal discharge coming from your anus. Another thing to keep in mind is that a lot of STIs don't have symptoms at all, but when left untreated, they can still cause problems. Specifically in those with female anatomy, you can get something called PID, or pelvic inflammatory disease. We worry about PID when someone has lower abdominal pain and fevers. STI testing recommendations depend on a variety of factors in the United States. First of all, whenever someone does become sexually active, it's recommended that we get some baseline labs to assess for STI presence. These include HIV, syphilis, which are blood tests, and then gonorrhea and chlamydia swabs, which are samples that are either taken from the vagina or collected from urine for male genitalia. When it comes to those with female anatomy, if you're under the age of 25, it's recommended that for every year you're sexually active, you have gonorrhea and chlamydia testing. This is because the cervix in younger people is actually more susceptible to catching STIs. So we want to make sure that we catch them and treat them as soon as possible. Once you turn 25, the cervix changes a little bit and becomes less susceptible to STIs. Thereafter, it's recommended that we check every year with new partners or every year that you have multiple partners. With male anatomy, STI testing is a little bit different. Again, it's recommended to have baseline testing once someone becomes sexually active. So that's going to be HIV and syphilis blood tests, and then gonorrhea and chlamydia tested through pee. But the only indications for STI testing after someone becomes sexually active is specifically for men who have sex with men. For men who have sex with men, it is recommended that STI testing is performed at least every year, and that includes HIV, syphilis, gonorrhea, and chlamydia checks. Depending on the type of STI, there are a few different ways that we do STI checks. The first is with a blood draw, and that's specifically for HIV and syphilis. If we're worried about something like herpes, which is a viral infection, we actually have to take a skin scraping from an ulcer that might be present in the genital region, and that's how we make the definitive diagnosis. Finally, for things like gonorrhea or chlamydia, it depends on the type of anatomy that you have. For those with male body parts, we can usually check for gonorrhea or chlamydia with a pee sample. However, If you've peed too soon before the exam, we may have to do a penis swab. So it's best to wait about an hour before your check so that you can provide a urine sample instead. If you have female anatomy, there are a few different ways that we can check for gonorrhea and chlamydia. They include one, a swab, and that would be me simply handing you a swab, and you can swab your own vagina. We can also oftentimes check for gonorrhea and chlamydia and a few other infections with a pee sample. Now, if you have female anatomy, there's one more way that we can check for STIs, and that's through a pap smear. Pap smears don't start until you're 21 or older, and the way a pap smear is done is a speculum is used to insert into the vagina and to look at the cervix. And the doctor will just take a swab and swab directly the cervix to check for gonorrhea, chlamydia, and a few other types of STIs. STIs can have a lot of different symptoms, but the most important thing is that sometimes there are no symptoms at all. The only way to know if you really have an STI is to get a check with a doctor. I hope you enjoyed this video. If you're interested in learning more with us at Julie, hit the subscribe button. If you have a specific question for us, you can enter it in the comment section below. Thanks for watching.